The monkeypox virus is spreading in major metropolitan cities across the country. Louisiana has 97 cases as of this morning. In New Orleans, the LGBTQ community has hosted a series of free vaccination events, offering incentives like a shot of alcohol for a shot of the vaccine. We visited one of those pop-up sites on Tuesday, where a line of people wrapped around the block. The World Health Organization declared monkeypox a public health emergency, which means the agency has recorded significant outbreaks across the country.
More than 18,000 cases of monkeypox have now been reported to WHO from 78 countries, with more than 70% of cases reported from the European region and 25% from the region of the Americas. So far, 5 deaths have been reported.
In the U.S., the cases climbed over 10,000, gay men making up the largest population of infected individuals.
We're here to get our monkeypox vaccine. I think getting a vaccine is kind of your responsibility if you're a member of a community. It's your ultimate fulfillment of your role as a member of the community. So we're here to protect each other and ourselves.
And because we've learned that you have to take care of your own health, and at the same time are very appreciative of a bar going out of its way to look out for the community's health.
Vincenzo Pasquantonio and Brian Sands are at the Phoenix, which is a gay bar in New Orleans. Tuesday, the staff partnered with the Louisiana Department of Health to give out 500 doses of the monkeypox vaccine, which has been hitting the LGBTQ community hard.
There is a higher number of monkeypox cases being identified among men who have sex with men, but it's not exclusive.
Though it's very possible for other groups to become infected, Jimmy Gale with the Louisiana Department of Health and a part-time bartender at the Phoenix says that reaching this community is imperative.
With Southern Decadence rapidly approaching and Red Dress Run coming this weekend, there's been a lot of community concern about getting access to a vaccine, and Louisiana wasn't allocated very many doses to start.
Monkeypox vaccines are scarce nationwide. The CDC classifies about 1.7 million people as at risk for infection, but only 1.1 million vaccines are available, which means thousands of people could go without it. In Louisiana, the same story. Only about 9,000 vaccines are on hand.
And we are reliant upon federal allocation. Allocation is dependent on the number of individuals within a state that have tested positive for monkeypox. So there are states that have considerably higher numbers, so therefore they're getting higher allocation.
This means that outreach programs are crucial. The CDC is already creating social media campaigns and reaching out to pride organizations to spread the word. But Chantel Hebert-McGee with the State Department of Health says the best strategy is a page from the COVID response playbook.
We didn't want to overwhelm our providers or disrupt clinical services, so we said, how can we engage the community and meet people where they are? So we collaborated with the New Orleans Health Department, with local bar owners, and we really tried to broadcast to our particular targeted community to ensure they got the vaccine in the most timely manner and a space that they feel comfortable.
The Phoenix started rolling out vaccines at 4 p.m. By 4:30, all the forms for shots were out. Adam Tatar, the bar's social media manager, says this was the outcome the staff hoped for.
I'm not a health professional. I'm just, one of the guys here. And, you see this thing that's creeping up and you hear about it starting on the news little by little. And all of a sudden it's this kind of really scary thing. And even though it's been pretty clear that it's not lethal, it looks really ugly and miserable and contagious. And especially here in New Orleans, especially at the Phoenix.
This isn't the only vaccine event taking place. Another one was held at the Page Bar in the French Quarter on Thursday, and locals are also preparing for a possible vaccine pop-up at the Red Dress Run this weekend.
We're all very social. It's a very scary thing that's reminiscent of other things from our past, and so it kind of got everybody in high alert, and especially the challenge of accessing the vaccine or finding out when can I get the vaccine.
As for the supply shortage, the state may have a plan. The FDA just greenlit a new injection method. It's called the intradermal injection, which is a fancy way of saying the needle will be injected in between layers of skin instead of directly into the bloodstream. This method uses less of the vaccine, so a smaller supply can go a lot further.
Instead of providing subcutaneous injections, research has shown if you actually provide intradermal injections, you can vaccinate more than one person, up to 5 people with one vial.
That wasn't the method used at the Phoenix on Tuesday, but it could become a game changer in the near future. In the meantime, though, Pasquantonio says he wants to see more of the LGBTQ community take advantage of shot-for-shot events, despite any existing stigmas.
Anytime we have a disease like this, and this was the case with COVID and a lot of other diseases in our memory, in our community, it's always going to affect marginalized folks first, whether it's the LGBT community, whether it's the Black community, whether it's people with trans experience. So don't be afraid of that stigma. Protect yourself, protect your community. Don't listen to the haters. Don't listen to other people that are stigmatizing it. We have this vaccine, and we have the community to support, one another, and we can protect ourselves.